I think first is starting with the human, right? You really need to define your statement, the human statement. What is this technology? How is it supposed to enhance the patient care? How is it supposed to enhance the workflow? And really define that and make sure that you're keeping the human focus there.
Yeah, I think that what's going to make sense, and we're going to dive into this, I think, in subsequent sessions in this series, is probably standing up internal working groups. And so this is going to be kind of cross sections across the health center. There'll be representatives from clinical and operational, administrative, governance, IT, and they're going to start to work through the process of attaching values to Bill's point with the CFO or to whoever has those numbers. And they're not always going to be dollar amounts, but it could be hours, and it could go all the way down to outcomes. It really depends on the workflow, but you need to start to attach sort of value and what's the complexity here. And so is there a shorter win versus longer, and you might still decide to go on those longer ones. But you have to start to draw the landscape of what the opportunities are and start to involve those stakeholders in the organization that do understand where the pain points are. They understand where people are spending lots of time doing repetitive tasks. They understand where there's accuracy problems or where there's security problems, and having them start to surface what's the most important things in their health center.
Yeah, I just wanted to go back what Andrew spoke about with the working groups. That is really, really important. Anybody who knows me knows I'm a believer in employee task forces, as we call them, at Thrive, which is, folks across the board, right? We have a provider, we have front-end staff, MAs, nursing, guy from finance. So deploying it through these task forces is really going to help minimize missing something. A lot of times it's driven just by leadership. And when you do that, you don't have the people working day in and day out addressing what the true needs are. So I think those task forces are critical to success.